We can talk about this. This is sometimes helpful, sometimes not. But it kind of gives you a sense of how this might work. Often it's a small group of people where an idea or a vision emerges and they start talking. And the next phase, this is really the lengthy phase, usually takes between 12 and 24 months, where they do a deliberate process of getting as many people as possible engaged in the idea. Often thousands of people in some form of conversation and feedback. And they're doing it not only to get ideas. Remember I went back to this thing around inform, involve, consult, that whole continuum. That's very important in this phase, because what we're really trying to do is build engagement, getting a whole bunch of people excited about the idea before we start coming up with what it is we're going to work on. And the best way to get someone excited about an idea, right, is to make it their idea, right? So that's why you have to involve people and engage them. Then there's often this process of what we call creating the conditions of success, which are just really organizing yourself to act, which is often putting together a formal leadership roundtable that leads the process, finding the funding, putting together a community plan, formalizing the membership, and then launching the initiative. And that's usually what happens here. And then there's a whole series of work around implementation. And for the most part, we look at implementation as being something that is a 4-year maximum. We've seen it go 5-6 years. Because what happens is that the whole system starts to lose momentum. So we run a lot of these as campaigns, which is why we talk about renewal and wind down. Here's some of the work that a lot of the roundtables do. One is that they just work at raising public awareness. It's a big part of the work of really starting to talk about, if we're going to talk about children's mental health, if we're going to talk about youth suicide, if we're going to talk about the issues that are important to us, the general health of our population, there's all kinds of ways of doing that. And when we go back again to this phase here around building the community will, right? And then we look here to raising public awareness. That's often what happens here. And we raise public awareness by really engaging people in really good conversations about what's going on. That's why the book I wrote was called Community Conversations, because I really see this as a very central part at the early stage of this work. Helping the community get strategic focus. That's another part. The system, in order, remember we talked at the beginning, and you're starting to get lost because I'm talking. I'm going to stop talking in a little while. But I get so excited about this, right? So what ends up happening is that, remember at the beginning I left you really depressed before the break? You know? And the thing is that we can do all this good work, but the system really needs to change in order for us to go to the next level. Remember that? You know? And so that's really what we're talking about here, is that we're trying to help the system come to agreement. But again, you know the difference. Just think of your organization the last time you did a strategic plan. You know? And some of us have had the privilege of having a really good strategic plan where after we didn't have to read it because we were so involved in designing it that reading it's actually anticlimactic. Right? And then we've been involved in those strategic plans where someone gives us the paper and it's colder than the paper that it's written on because it means nothing to us. Right? And we all know this as administrators, that those kinds of strategic plans are absolutely a waste of time because they require all of our energy to enforce and police, right? And to drive. It's exhausting, right? And so we're better to figure out how we can come to common agreement and common focus so that this is what Margaret Wheatley talks a lot about spontaneous action. You know, that's why in Hamilton, $5 million had already been redirected by a whole bunch of different funders. 11,000 people had already been helped by a whole bunch of different players who happened to say, it's because of what happened here, I already started changing. I wasn't going to wait for a plan. It just made so much sense that we work together at this level. And then many of these roundtables hire a small staff and help organizations do all kinds of interesting work. So once the system starts to say, it starts to bubble, okay? Remember that? The pumping, you know? It starts to pulse, right? And ideas start to pop up. And there's more crazy women jumping up and down, right? And these then are the people, not just women, men too, but I'm using that one example. Please don't get that wrong. And they have an idea, and they're excited, and they're passionate, and they're bringing other people together. So now what a big part of the collaboration is to feed that, is to help that. And it's spontaneously, it's happening all over. Systems don't change the Christopher Columbus way. You know, they're planned, they're organized, I remember Dieter Kays, who was the executive director of Lutherwood, because I took over, I started this emergent process. He took over this big organization now called Lutherwood CODA, and we were under there. They were our sponsor. And I remember him pulling me into his office and just saying, Paul, this is going crazy. It's happening everywhere. Every major news outlet's talking about it. We've got all the leaders working on it. What if something goes wrong? We're going to be liable. We got to stop this. We got to get this under control. And I just said, oh, Dieter, don't you just love it? It just doesn't make your heart sing? Aren't you just like alive? And he just stopped because he's such an administrator. He's so anal. And he just started laughing. He fell back in his chair and just started laughing and laughing. Because he knows intuitively that anything that's of worth is alive. It's pulsating, right? You can't control it. You can only be present. You can only be present. So, here again are some of the functions. This is what causes money to flow. And in Vibrant Community, we've raised $27 million, most of it from the private sector, all across the country. We've never had a funding problem. It's because of what we call our triple bottom line. We can generate many more outcomes than individual outcomes, even though we track these outcomes because they're very important, the people outcomes. But we also can say that the capacity of the system to do more, we can measure that that's being improved. That's called organizational outcomes. That's when the players and the whole team is learning better moves and better skills, right? And over time, they get better and better and better to the point where they win the cup, right? So they're starting to have these organizational outcomes are starting to happen. We're starting to learn to work better collaboratively. We are more knowledgeable about the issue. We take things, and then there's this whole third level, which is the ability of a system to perform. And that is the gold. That is the magic. That's why when we start to look at the evidence that the more collaboration that happens in a community, the better they get at it, the easier it becomes. We already are, there's just a general consensus. Everywhere in the country, almost all over the world. It's communities that know how to work together that are going to be more successful in the future. It's common wisdom now. It's universal wisdom. And yet we invest nothing in making it happen.